is Jessie Hickner, and I am the summer intern for the Family Health Clinic. And for our 25th anniversary, which is this year, we're interviewing our staff and some community members to kind of explore what the Family Health Clinic means to them and how they've seen it grow. So in this video, we're interviewing Barb Hickner to my left and Antionette Valle, who is on the other screen. So why don't you go ahead and introduce yourselves?
Hi, my name is Barb Hickner, and I am the Outreach and Enrollment Coordinator at the Family Health Clinic. I started in October of 2013 when the Affordable Care Act brought about the opportunity to assist patients with insurance enrollment.
Awesome. What about you, Antoinette?
Hello, everyone. My name is Antoinette Valle. I'm an Outreach and Enrollment Specialist here at the clinic. I help assist patients and non-patients in the community with their insurance needs through Marketplace and Medicaid. And a fun fact, I will actually be taking my SHIP training next month in August. So I will also be able to assist patients with Medicare, and I can provide all of my services in Spanish.
Awesome, awesome. How have you two seen the Family Health Clinic grow in the community since you first started?
Yes, so I started in August of 2018, so coming up about 2 years. The Monon Clinic is where I'm mainly at, and in August of 2018, the new clinic was actually opened. The clinic was built on land that was donated by the John G. Brown family, who were historical farmers in the area. So our new clinic has 6 patient rooms, a separate laboratory, a separate nursing station, break room, versus the old clinic that I never got to work in, but I did have an interview and got to see. There was just 2 patient rooms, a very small waiting room. The break room and the laboratory room were kind of like shared spaces. And now we have 4 full-time full nurse practitioners, family nurse practitioners, excuse me, and then we have a pediatric nurse practitioner as well. So we have been able to expand how many patients we see here at the new clinic.
That's really cool. What about you? How have you seen it expand?
Well, prior to the navigator role that brought me to the clinic, patients were expected to navigate the challenges of insurance and any kind of supporting services entirely on their own. The case management role that we offer has allowed the opportunity for patients to not only understand their options, but to access care that's provided by the clinic, as well as services from specialists if we need to refer them. So now patients are not only able to receive assistance locating other resources like food assistance, housing, and job placement, but they kind of have a place to come to look for those services. And so the navigator's role has really turned into more of an expert in the field of connecting than simply helping people obtain their health insurance. So the outreach efforts that we do in the community, they allow us to promote the services we provide, which has increased the number of patients that we see.
Yeah, that's awesome. Getting a lot more outreach into the community. So what are some ways that you have seen the Family Health Clinic impact our community in a positive way?
So I'll take that one first. The Family Health Clinic's impact in the community has really grown by leaps and bounds. So 25 years ago, when the first clinic started in Delphi, there was 1 nurse practitioner and 1 medical support staff, and they were housed in a small office space on Delphi's town square. So since then, the clinics have grown to 4 locations plus an administrative building, and now we employ over 75 people that help manage all of those tasks. So in 2020, we expect to serve over 8,000 patients, and our services have now expanded past just the medical services, and we include behavioral health, pharmacy, and the navigator role that Antoinette and I fulfill. To accommodate the specialists that are in pediatrics, family, and women's health with our medical providers.
That's great. How have you seen it change, Antoinette?
Yes, so the Family Health Clinic has impacted our community by a lot of the community service that we provide. We attend several community outreach events every year. A good example would be backpack operation that normally is in August to help supply our local families with school supplies. And we provide first aid kits. We also attend the Coats for Kids, and they give family winter coats, hats, and gloves, and the Family Health Clinic helps provide with nice warm socks. So I say that we influence our community by being a trustworthy source, being at these outreach events, having tables to give information. So we're able to support and collaborate with our, community partners through that way.
Yeah, that's great. What does being a part of the Family Health Clinic mean to you? Antoinette, why don't you take this one?
Yes, so being part of the Family Health Clinic actually means a lot to me. My role gives me a great sense of belonging, and it's also rewarding because I can help people and give back. I enjoy helping others and building the connection and bond with them, especially through our community members, and I feel very privileged to be in this role with the clinic.
Yeah. What does being involved with the Family Health Clinic mean to you?
So for me, being a part of the clinic means being larger than something just myself. And it means being part of a movement for change and inclusion. Everyone is welcome to come to the clinic despite their ability to pay for services. So the sliding fee scale for those without insurance gives them the possibility to access to medical care. And so for me, being one piece of the puzzle in something that is much greater than anything an individual could do is really the best part of it. So for us being considered the experts in the community, it does come with some pressure, but also allows each employee here to know that they're a needed part of something much greater.
Yeah, very true. What is one thing that you want the community to know about the Family Health Clinic that maybe they don't know? Why don't you take this one?
Okay. So I think the most important thing is to let the community know that we're here for everyone, and we strive to help individuals connect to medical care as well as available community resources, and then to help break those barriers that many experience to offset the disparities that they experience that may have prevented them from achieving their own personal goals and seeking their own medical care in the past. So we're here.
What about you, Antoinette?
Yes, I kind of have the same mind frame as Barb, that I do truly believe that we have the family's health in mind here at the clinic, and we strive to deliver a patient-centered care model here, and at a holistic approach. We want to take care of not just their insurance needs, but their medical needs, or if they need needs at pharmacy or their mental health, kind of an all-encompassing role. And we want to make sure that our families can thrive in our communities and stay strong and healthy.
Yeah. Well, Antoinette and Barb, thank you so much for your time and your involvement with the Family Health Clinic. The community is better because of you too. So thank you.
Thank you.